Today's video is a guide for C-section pain and recovery. A C-section delivery can be a stressful experience for mothers and their families. While the process is generally considered safe and effective, the pain and recovery after the C-section can be overwhelming. A C-section delivery, also known as a Caesarean section, is a surgical procedure in which a baby is delivered through an incision in the mother's abdomen or uterus. In recent years, the rate of C-section deliveries has risen dramatically in many countries, with some estimates indicating that C-section delivery accounts for more than 30% of all births. Although C-section delivery is a safe procedure, it can be accompanied by pain and discomfort. Pain severity during a C-section delivery. The pain associated with a C-section delivery will vary depending on the individual. Some women may experience mild pain and discomfort throughout the delivery, while others may experience more intense pain. During the procedure, the doctor will administer a regional anesthetic, typically an epidural, to help ease the pain. The doctor may also administer a C-section injection, also called a spinal block, which is an injection of anesthetic into the spine to completely numb you down from the chest to your legs, so you won't feel the pain of the incision, and usually a vaginal birth is more painful than a C-section delivery. But of course, it differs from one person to another. Pain severity during recovery. Following a C-section delivery, the mother may experience a variety of recovery pains, including abdominal and pelvic pain, as well as pain in the area where the incision was made. The pain will be very strong in the first few days, and then it will gradually subside. You'll also experience pain at the incision point when coughing or sneezing. It is not uncommon for you to also experience a burning sensation in the vagina or perineum, as well as a sensation of heaviness in the lower abdomen and pelvis. Additionally, you may experience back pain from carrying the weight of the baby for 9 months, as well as pain with urinating because the doctor makes an incision very close to the bladder, which can cause irritation and spasms. Your doctor will probably prescribe anti-inflammatories such as ibuprofen to help reduce the pain in the first days or weeks. Can a C-section delivery hurt the baby? In most cases, a C-section is a safe and effective way to deliver a baby. There may be a risk of injury to the baby during the procedure, such as cuts or bruises. Fortunately, the risk of an injury to a baby during C-section is very low. The baby is carefully monitored throughout the procedure, and the doctor will take all the necessary precautions to ensure the baby's safety. Risks of C-section delivery. A C-section delivery is a major surgical procedure, and like any surgery, it can carry a number of risks for both the mother and the baby. The most common risks associated with a C-section delivery include infection, blood loss, and complications from anesthesia. Infection is a risk for both mother and baby and can occur in the uterus, bladder, or other organs. Blood loss is also a risk, as the mother may lose more blood than with a vaginal delivery. Complications from anesthesia can include nausea, vomiting, and dizziness. But still, C-sections are often necessary to ensure the health and safety of both the mother and baby. And with proper care and monitoring, a C-section delivery can be a safe way to deliver a baby. How to recover better. The best way to reduce pain and discomfort associated with a C-section delivery is to follow the doctor's instructions closely and to practice proper self-care during the recovery period. You should avoid lifting heavy objects, standing for long periods of time, and engaging in strenuous activities. You should also wear loose clothes to avoid friction with the incision point. Additionally, your doctor will prescribe pain medications to help reduce the pain and discomfort associated with the C-section delivery.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.